Pinched nerve in the foot is the subject of this video. I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. Stay tuned. All right, so you have this pain that shoots in your foot and you're thinking it's a pinched nerve in the foot. So you may be a runner, you may be a hiker, you may just not be active, and yet you have this issue. And so is it really a pinched nerve in the foot? Hardly ever there is a pinched nerve in the foot. Almost always it's a dysfunction in the ankle joint. So as musculature gets connected to the bones, they connect as tendons. And if there's a dysfunction in movement, meaning you're able to move your ankle, as an example, or your foot, but not based on the proper design of it, which you don't need to know. It's an automatic, your body needs to know. But as a result of lacks elsewhere, typically right above the knee, the hips, the lower back, and the sacroiliac joint, which is your SI joint. As a result of something that is potentially painful higher up, you may or may not know, your brain 100% knows, it shifts the movement right before you actually have the pain. So let's say at a certain amount of flexion of your hip, you get pain. Just below that, the brain knows that's going to be painful. Just below that point, it shifts the task to something else to finish the whole flexion of the hips. So when the primary muscle is to do this primary job, but they can't for whatever reason, then the secondary group of muscles whose job was something else now needs to do its job and pick up this load. And the decline takes place. By the time it gets to the ankle and foot, it's quite a bit of issues. So for you to think pain shooting down your foot, so it's a nerve pain, the answer is no. It's a dysfunction causing issues, and the issues are causing pain. So then what are those issues? It depends. I hate those answers because that doesn't really give an answer, but it really depends. There's so many muscles going to your feet, and your feet themselves have so many muscles to begin with whose job is to move your toes. So all of those have to be addressed. The biomechanics, the movement has to be addressed. A steroid injection is not going to cut it. What are you doing? You can't just inject the heck out of a joint, not even knowing what happened to begin with. If you have an inflammation somewhere that causes pain, the number one question is, why was it inflamed? What is inflamed? And how do I stop it from getting inflamed again? When you go and inject it, the inflammation goes down, but the dysfunction is still there. So it's only a matter of time before the inflammation comes back. So pain or pinched nerve in the foot more than likely doesn't even exist as a pinched nerve. It's an imposter. It's a dysfunction. It's the trigger point in the muscles. It's the dysfunction in the movement. Who do you go to fix? That's a good one. When you go to see a physical therapist, they work out the musculature in the foot, in the ankle, hopefully in the knee too. But that's only part of the solution. When you go see a chiropractor, they may adjust the ankle joint. They may rehab those musculatures that I just mentioned, which once again will help, but it's part solution. You need to carry this problem all the way to the whole body. That means the assessment needs to be of the whole body. The exercises you do need to involve the whole body. The treatment has to involve the nerve command given by the brain to the body part. We're talking about postural neurology here. I don't want to make this video into a postural neurology. We'll make sure we put in the description box, or if we can put at the end of this video more about the postural neurology, we'll see what we can do. If you don't see it at the end of this video, go to the description box and we'll provide a link for you so you can better understand it. But these part solutions only provide part relief or short-term relief. We need to address the problem all the way to the brain and all the feeders of the problem. Does that mean it's going to take forever? No, not at all. It's much simpler than you realize. Anyway, if you have any questions, make sure you contact me using one of the methods of contacts in the description box, and make sure you subscribe to the channel and check out the other playlists I have in the channel. They should be helpful to you too. Thanks for watching.